If one had to name a country where merely mentioning an infectious disease outbreak instantly evokes unease or even fear, India would almost always rank at the top. This isn't because Indians are dirty, backward, or ignorant. Those are stereotypical, superficial, and inaccurate judgments that fail to explain the real issue. The true reasons are far deeper and more complex, tied to geography, climate, population structure, and the unique relationship between humans and nature in this country. We're talking about why India so frequently becomes a hotspot for dangerous infectious diseases worldwide. One of the most terrifying examples is the Nipah virus, which caused a major outbreak in 2018 in Kerala, with a case fatality rate exceeding 90%, specifically around 88 to 91% in confirmed cases, with 17 out of 18 or 21 out of 23 deaths reported, depending on the exact count of confirmed or probable cases. These figures are real, not exaggerated or misunderstood. Nipah is a zoonotic virus transmitted from animals to humans, and in recent years, many infections have been linked to people drinking fresh date palm sap contaminated by virus-carrying fruit bats. According to the World Health Organization, WHO, Nipah outbreaks are not rare. In Bangladesh, they occur almost annually. In India, Nipah has appeared multiple times, but the severity is often higher. So what makes India an ideal environment for deadly viruses like this? First, consider India's geographical location and climate. The country lies squarely within the tropical monsoon belt, a climate that epidemiologists often call a paradise for pathogens. Year-round high temperatures, high humidity, prolonged monsoon rains, and regular flooding not only affect human life, but also directly determine the survival and spread of viruses. In humid environments, many viruses and bacteria can survive longer outside the body than in cold, dry regions where they are easily destroyed by dryness and low temperatures. During heavy, extended rains, overwhelmed drainage systems lead to stagnant, dirty water, easily contaminating sources of drinking water. Viruses and bacteria not only persist, but spread widely. In many rural areas and slums across India, people have little choice but to use untreated water for daily needs, bathing, cooking, and even drinking directly. These seemingly ordinary activities inadvertently become direct bridges between humans and pathogens. The combination of climate, flooding, and infrastructure conditions means diseases in India don't just erupt randomly, they recur cyclically, like seasonal epidemics. However, geography and climate alone don't fully explain it. Many other countries share similar tropical climates. What makes India uniquely and more dangerously vulnerable is its population. As the world's most populous nation, with more than 1.4 billion people, the sheer number isn't the biggest concern. The real danger lies in how this population is distributed and lives. In major cities like Mumbai, Delhi, Kolkata, or Chennai, people aren't just numerous, they're packed into extremely cramped spaces. Slums sprout densely, with population densities far exceeding those of already crowded cities like Tokyo, New York, or London. In tiny rooms meant for 1 or 2 people, 3 to 4 generations may live together, eating, sleeping, cooking, and personal hygiene, all in shared, boundaryless spaces. This overcrowding extends to public areas. Hundreds of thousands or even millions share the same toilets, water sources, and public transport daily. In such an environment, if one person gets infected, transmission can explode almost immediately. Epidemiologists call this a high-density continuous contact environment, where viruses don't need complex evolution or sophisticated mutations to spread at lightning speed. In many parts of the world, viruses struggle to find hosts. In India, humans unwittingly line up in tight queues, creating perfect conditions for viruses to freely select and move between hosts. And it doesn't stop there. The boundary between humans and animals, the source of many dangerous emerging infections, is blurred in India. Most of humanity's deadliest viruses have zoonotic origins, and India combines nearly all the factors that make such spillover frequent. The country has hundreds of millions of livestock raised in small-scale, scattered household systems where people and animals live very close proximity. Traditional live animal markets remain common. Wild animals like monkeys, rats, and bats live right next to residential areas, sometimes even ending up on the dinner table. For the locals, this is entirely normal, but from modern medical perspective, it's an ideal setting for viruses to cross species barriers with just a tiny bridge. The Nipah virus is a classic example. Its natural reservoir is fruit bats, Pteropus species. Bats can carry the virus asymptomatically, shedding it in urine, feces, and saliva. When bats roost in fruit trees near homes, their droppings contaminate fruit or water sources below. Humans only need to eat contaminated fruit or drink polluted water for the virus to enter. No direct bat contact, no bites, no eating bat meat required. Why is Nipah so terrifyingly lethal? According to the World Health Organization, the global average case fatality rate ranges from 40 to 75%, already placing it among the deadliest viruses. But in the 2018 Kerala outbreak, it reached over 90%, specifically around 88 to 91% in confirmed cases, with 17 out of 18 or 21 out of 23 deaths reported, depending on the exact count of confirmed or probable cases. The main reasons include late detection. Early symptoms, fever, headache, fatigue, are easily mistaken for common flu or infections. By the time it's correctly identified, the disease is advanced, and the virus has already spread to others. Particularly dangerous is that Nipah doesn't primarily attack the lungs first. It targets the brain directly, causing encephalitis and meningitis, leading to severe neurological damage. Once the brain is affected, patients quickly become confused, convulse, fall into a coma, and survival chances plummet. To date, there is no specific cure for Nipah. Treatment is only supportive, sustaining life while the virus destroys the brain. When detected late, the disease progresses so rapidly that healthcare systems can barely respond. Fortunately, Nipah doesn't spread easily through the air like COVID-19. It typically requires very close contact or bodily fluids, so chains of transmission can be broken with timely detection. After the 2018 shock, India significantly improved its response: faster contact tracing, earlier isolation, better protection for healthcare workers. As a result, later Nipah outbreaks have been contained to small clusters. The story of Nipah and India isn't meant to spread fear, but to remind us that epidemics aren't random disasters. They result from how humans live, interact with the environment, and with each other. As long as we lag behind viruses, the worst scenarios can always repeat. Thank you for watching this story. If you found it meaningful, please subscribe, turn on notifications, and share this video. And now it's time to say goodbye. Thank you for staying with Societal Stories.